Hello everyone, this is Dr. Saketh, Consultant Pediatrician and Neonatologist at Virinchi Group of Hospitals. And today we have Dr. Beulah, Consultant Obstetrician and Gynaecologist at Virinchi Hospital. August 1st to 7th is considered as Breastfeeding Week, and this year's theme is Step Up for Breastfeeding, Educate and Support. So today we are here to discuss few of the common queries which we face in our day-to-day practice.
Hello everyone, this is Dr. Beulah, Consultant Obstetrician Gynaecologist at Virinchi Hospitals. Today we both will try to clear some of your doubts. Sir, the most basic question asked by everyone is when to start breastfeeding and what is its importance?
Breastfeeding, it should be initiated as soon as possible after each delivery. There should not be any difference between a vaginal delivery or a cesarean section. And it is always better to start breastfeeding or initiate breastfeeding within the first hour of birth. The quicker breastfeeding is initiated, the better the bonding will be between the baby and the mother. And as if the gap increases, it becomes difficult for the mother to initiate her breastfeeding. And there are innumerous qualities in breast milk which is very important for the baby's health. Like for example, there are a lot of immunoglobulins in the breast milk. There are many antibodies and which can give protection for the baby from diarrhea, any respiratory illnesses. It reduces mortality and it prevents a lot of other infections as well. It acts like an immune booster which gives proper immune response. And very important thing is all the 5 sensations of the baby, that is touch, smell, taste, vision, hearing, all are stimulated at the same time. And the bond between baby and mother is formed, and in the future also there are less risks for obesity, diabetes, type 2 diabetes, hypertension, any coronary artery diseases, and it also helps in preventing certain types of cancers. So if we go on, the list just keeps growing. So I think that is the most important factor of breastfeeding for babies. And one more thing is the frequency of breastfeeding at least should be every 2 to 3 hourly and not more than that. Like the gap should not be more than 4 hours at least. So even if the baby is sleeping, we should just tickle the sole or we should just ear stimulation and then try to give feeding as much as possible.
In another question, sir, in conditions where the mother has multiple babies like twins and also where the mother delivers early, that's in premature babies, how difficult or how beneficial is the breastfeeding?
Answering to this particular question, ma'am, it is a little difficult for breastfeeding in premature babies, especially when the babies are between 28 weeks of gestation to 32 weeks of gestation, where the sucking is immature. They will just have bursts of sucks and there won't be any coordination between breathing and swallowing. So ideally the kind of feed which we should give is expressed breast milk through a nasogastric or an orogastric tube, and for babies between 32 to 34 weeks of gestation, the suck will be a little more mature and mild coordination will be there between breathing and swallowing. So along with spoon feeding, we can try for breastfeeding as well in such kind of babies. But for more than 34 weeks gestation babies, it is more mature. The sucking and breathing and swallowing, there is a coordination among them, and then we can initiate breastfeeding easily for such babies.
Sir, how will we know that the breastfeeding is adequate, that lactation is good?
So regarding the adequacy of feeding, ma'am, usually mothers when they start breastfeeding, the opposite breast or the other breast, it starts dripping milk, right? So that means they have adequate quantity of milk. And secondly, the baby should sleep for at least 2 hours after a feed. Post feed, at least baby should be sleeping for 2 hours pleasantly, quietly, without any disturbance. And the urine output should be at least 6 to 7 times a day. They should pass urine at least 6 to 7 times in a period of 24 hours, and adequate weight gain should be there. So once the baby is gaining weight, at least 30 grams per day. So that is a rough estimate which we look out for. So initial 4 to 5 months, at least daily the baby should gain at least 30 grams of weight per day. And the babies will be playful, active, they won't be cranky and crying. So these are the factors which we look out for to know that the breastfeeding is adequate.
So how to ensure that the baby is well attached to the mother during breastfeeding, and what are the positions in breastfeeding, sir?
So regarding the position, usually mothers, they should sit upright and have a back support. Lying down and feeding, some mothers do that, but it is not advisable. And they should hold the baby. The head and neck should be supported by the hollow of the elbow, and forearm and hand should support the buttock and back of the baby, and they should sit upright. For adequate attachment or latching, as we say, mouth of the baby should be wide open, and entire nipple and 3/4 of the areola should be inside the baby's mouth, and chin of the baby should be touching mother's breast, and the lower lip should be everted. So these are the signs which we look out for in good position and attachment.
And mainly, sir, what are the factors which contribute the mother to choose breastfeeding exclusively?
So this is the most important question, ma'am, actually, which we should address. The most important factors are, one is, all the mothers should have self-confidence in their abilities. No one is inferior. And one more thing is, they should have adequate rest, good hydration and nutritious diet, and pain-free, stress-free environment should be there, and they should be getting a lot of emotional and family support. And at the same time, if the baby is actively sucking on the breasts, mothers will feel confident and they will continue to do breastfeeding. So, ma'am, day to day we face a lot of problems. So are there any advantages for the mothers if they breastfeed their babies?
Yes, sir, there are many advantages for the mother when she breastfeeds, mainly bonding between the mother and the child, sir. Breastfeeding releases hormones like prolactin and oxytocin, which are happy hormones which stabilizes the mood of the mother. And next, it also helps to retract the uterus, which also reduces bleeding and prevents anemia. And another advantage with exclusive breastfeeding is, sir, it gives contraception action, sir. So the mother doesn't conceive for at least 6 months. And cancers, sir, ovarian cancer, breast cancer can be avoided when given breastfeeding, prolonged breastfeeding. So more about 1 year breastfeeding can help her.
So breastfeeding importance, does it start only after the delivery, or should we even start during their antenatal visits itself?
Breastfeeding importance should be explained to the mothers during antenatal period only, sir. We counsel them at each visit in the late trimesters, and we explain them to set their minds to breastfeed exclusively. The family is also counseled to give enough support, and we examine her breast during the antenatal period. Any inverted nipples or any breast lesion should be taken care of beforehand. Any inverted nipples, we ask them to massage the nipples, and any breast lesions will be taken care before delivery.
And one more question which we commonly face is that a lot of mothers, they ask, are there any medications which can be used to increase the production of breast milk?
Yes, sir, they are, but mainly we have to give good nutrition and hydration to the mother. Good emotional support is more important. Then if still the mother is not confident to breastfeed or there is less milk production, then we will help her with some galactagogues, which may help her, yes, for production of breast milk, sir. And also there are some drugs which also improve breast milk, but they are rarely given.
And what is the diet which a lactating mother or a mother who is giving breastfeeding should follow?
In pregnancy and lactation, the demand is more, sir. So we advise the mother to take about 2,500 kilocalories per day. Hydration is more important than diet, sir. In diet, we ask her to take more vegetables, fruits, dry fruits, food rich in antioxidants, iron and calcium. All colored vegetables, sweet potato, broccoli, green leaves, more of green leaves, they should be taken, and fruits which are like orange, strawberries which are rich in vitamin C, bananas can be taken, dry fruits, fenugreek, chia seeds, flax seeds, these all help in improving breast milk production, sir. Eggs, lean meat, seafood like fish, it is rich in DHA and omega-3 fatty acids. They help in the brain development of the baby.
What are the common problems or difficulties which a mother faces during breastfeeding and during her lactation period?
Yes, there can be difficulties like cracked nipples, sore nipples, breast engorgement because of incomplete emptying, and sometimes they can develop breast abscess. To avoid these, we ask the mother to clean the breast before and after every feed, because the baby's mouth is full of organisms. They can develop infections which may cause abscesses in the breast. To avoid these problems, it is better to clean before and after every feed, and also to maintain good hygiene. And mainly the mother's mindset is most important to breastfeed the baby, and there should be good family support, sir, for exclusive breastfeeding.
So it was a great discussion, ma'am, actually, knowing a lot of new things today. So to conclude today's session, I would like to say breast milk is the best milk, and it is the optimum nutrition which a mother can provide to her baby, and that's why we should support all the lactating mothers and help them in whichever way possible for us to promote exclusive breastfeeding. Thank you.
Visit Virinchi Hospital for evidence-based treatment.